Anne-Claire. I'm a specialist in internal medicine, a diplomat of the American College. And I would like to give you a few tricks to get more out of your normal physical examination. First, you look at the pet. Is he standing normally? Is he trying to avoid to put weight on one leg? Is his body normally grown? What is his body score condition? All of this information could be really good for you to notice and to keep in mind as well. I'll give you a few examples. If the body score condition is really low, then that could indicate a more chronic issue. If he is not putting weight on one leg and the pet is not eating, that could be a clue that he might be in pain. So you can get a few tricks like that. You have a look as well as his general demeanor and general appearance as well. Is the coat really nice and shiny? Is the coat dull? Is the pet happy and looking at you, or is he anxious or stressed? All of this information will also help you to interpret what you're going to look at after. When you do your physical examination, I would advise you to start always with the same thing and finish with the same thing, so it becomes a routine and you don't forget anything. Then you can start just feeling their muscle around the face. You can feel the jaw as well. If it's nice, you can open the mouth. Usually I do recommend to do that to feel if there is any abnormal tension. You can lift the gum, check the color of the mucosa, color of the gum. And if you have a doubt, you will then check the color inside the eye conjunctival mucosa as well. To finish with the face, I will then look at the ears. Inside the ears, are they red, are they normal, is there too much ear wax, or are they clean? Now that you've done that, it's just a general examination of the head. You can, if you want to, do a more profound neurological examination of the cranial nerves, but we will discuss that in another topic. Once you've done that, you can move down to the neck. So what's to feel in the neck? You can feel under the masseter and under the mandibles for the lymph nodes or the salivary gland. Is there any enlargement, any pain, any swelling, any abnormal hot feeling, redness, anything like that? Then you go down, you can feel the trachea. You can feel around the trachea the thyroid gland, mainly for cats, and see if there is any abnormal lump. Once you've done that, you can continue to just move your hands all along the pet's body to feel for any abnormal growth, lump, anything under the skin or on the skin that would be unusual, and just to mentally record it. If you have any doubts about your lymph node in the neck area, I would encourage you to assess the other lymph nodes. So the one you can assess on the general examination will be the pre-scapular lymph nodes, which are just at the front of the scapula, the axillar lymph node, which are under the front legs, and the easier one will be the popliteal. The popliteal are good lymph nodes to feel because there is a little, usually fatty tissue around them, which makes them easier to assess in terms of size and also consistency. Some vets will recommend to do a rectal examination at the same time than the physical examination to make sure there is no abnormal enlarged lymph node or prostate for male dogs mainly. I would also advise you to put mild pressure on the back and same to assess for any abnormal discomfort or pain. That was just a quick summary to help you to get more out of your physical examination. I hope you will find this interesting or informative. And for the next episode, I will go a bit more into specific for heart and lungs auscultation. Thank you for your time with us, and we'll see you for the next episode.